Hi, today we're going to be talking about PROM. PROM is passive range of motion, which is used on patients who have problems moving their body. It is commonly used on patients after surgery and they are unable to move on their own, or they have some type of neurological condition that doesn't able them to be able to do the joint movements that people usually do for regular joint health.
Before and after completing the procedure, wash your hands and communicate with the patient.
Hi, I'm going to be performing your PROM today. We perform these motions starting at the head and ending with the toes as part of standard procedure.
To begin PROM, you're going to lower the bed rails. And then you're also going to lift the bed up to your waist. Once the patient is at your waist, you're going to make sure that they are in a supine position so you can perform the procedure accurately. And then, before performing the procedure, make sure you uncover the sheet at the area you're going to be doing.
We're going to begin with your shoulders. First common exercise is flexion and extension. A common mistake people make is not fully extending the body part, which is important to maximize results. Support the elbow with one hand and wrist with the other. Then bring the arm up over the head for flexion and back down toward the body for extension. Next, we're going to do abduction and adduction. Still supporting the elbow and wrist, bring the arm away from the side of the body for abduction and back toward the body for adduction. Lastly is internal and external rotation. Bring the elbow perpendicular to the shoulder, pin it down with your arm, and then bring the forearm toward the body for internal rotation, and then move the forearm toward the head for external rotation. Now we're going to work on your wrist. For the wrist, there are 5 movements: flexion, extension, hyperextension, radial flexion, and ulnar flexion. Support the wrist with one hand and with the other one. Bend it down for flexion, straight for extension, and back for hyperextension. Bend the hand toward the thumb 20 degrees for radial flexion and toward the pinky 20 degrees for ulnar flexion. I'm going to work on your hip now. For the hip, start with placing one hand under the patient's leg and another one under the knee. Raise the leg up and bend the knee for flexion, then straighten the leg back down for extension.
A mistake people tend to make is not properly supporting the extremity. It is crucial to support the extremity to prevent shearing and potential pressure injuries.
Bring the leg away from the body for abduction, then back toward the midline for adduction. Turn the leg inward and outward for internal and external rotation. For the knee, you want to place one hand under the knee and another under the ankle. Bring the leg up, then bend the knee for flexion and straighten it out for extension. The last movement is the ankle. You're going to place one hand under the patient's foot and another one under the ankle. Bring the foot upwards for dorsal flexion and point it down for plantar flexion.
After completing all the motions, make sure to cover the patient, make sure that they are comfortable, and make sure that the cannula is within reach. Lower the bed back down and raise the guardrail back up.